Go ahead, Cecilia.
I'm concerned about, well, this relates to the health care, especially of our young people. Is the Congress doing anything about the rising rate of obesity and diabetes type 2, especially of our young people? And
Yep.
I do appreciate your adding fruit as an alternative to pastry.
Take them. In terms of the issues in healthcare, absolutely right. Probably the best way to address issues like obesity, diabetes, and all those things that are beginning to afflict our kids at a very young age is to make sure they have preventative healthcare services. Too many families can't afford to take their kids in for the basic checkups, dental checkups, eye checkups as well. And as a result, things get bad. And by the time a provider, a physician is finally examining these children, it's already beyond just an initial stage. And so one of the first things that we have to do is to try to provide preventative care services. We have in the Congress, on about 3 different occasions, passed legislation which would expand health care to about another 5 million children in this country. It's called the S-CHIP program, the State Health Care for Children's program. Unfortunately, the President has vetoed it each time it's come to him. And we haven't been able to override his veto. You need 2/3 of each house to override the veto. But we have passed it with large majorities. But the president has continued to veto the bill. He says he vetoes it because it's getting government too involved in health care. I say, well, then get the private sector involved with children's health care if you don't want the government. The private sector won't do it because these insurance companies won't take these families unless they can pay. And most of these families work very hard but don't have enough money to pay the high cost for the health care insurance. And so rather than not do anything, you have to make some choices. And one of the things that we did in the House of Representatives and in the Senate was pass legislation to expand health care to about 5 million of the 11 million or so kids in this country who still have no health care through expansion of the S-CHIP program. The S-CHIP program already provides health care to about 6 or so million children who otherwise wouldn't get it. We wanted to increase that to another 5, and that still leaves about another 5 who don't have the insurance or access to health care. I think it's a sin that a child in this country doesn't have access to health care. That's the best way to prevent those types of things from happening, like obesity. But at the same time, we have to do things, maybe not have pastries at Coffees with Your Congressman, to make sure that our kids are doing more healthy activity. When I was a kid, I used to be able to roam around on my bike after school until nighttime or until my parents said time to come in. I don't let my daughters go out on a bike and roam anywhere. Things have changed. And so it's more difficult to find the opportunities for kids to do exercise and do physical activity, which, by the way, going back to the whole issue of the Boy Scouts, is why things like the Boy Scouts and after-school programs are so important. We have to do more of that, and that has to be done at the local level. Remember, you don't want the federal government to do all these things because we're so far removed. We have to do the bigger things, national defense, national health care. But you don't want us to have the federal government making decisions on what the local community is going to do to try to keep kids active. We can help. We can try to provide some support and funding through the states, through the cities and counties, and then let the community governments decide what happens. But those are great questions because we're finding the issue, especially of obesity, becoming so big. And diabetes, we're finding young children. We're finding diabetes in our young people, which ultimately becomes a very expensive proposition for all of us. Because if you have to amputate a limb from someone, they're no longer as productive as they could have been. And there's a very good chance that taxpayers are going to have to take up some of the costs of making sure that person can continue to go on in life. Okay,